Two of my patients won't be home with their families this Thanksgiving. I'm not going to go into the gory details, but I am going to tell you what that does to me as a surgeon. One of them had a complication on my watch, and I recognized it, we managed it. He's still in the hospital recovering, and I think he'll be okay, but it leaves a mark. And the other, sadly, she died. And not because of my procedure, not because anybody failed her, but she's still gone. And her family now has a chair at the table that nobody will sit in again. I'm Dr. Lily Johnston, vascular surgeon on a mission to put myself out of the surgery business through prevention, because surgery has desperately real consequences, even when everybody does everything right. And I think people sometimes assume that surgeons aren't affected by this because we move on to the next patient, the next operation, the next crisis without missing a beat. But the truth is, we're not unaffected. We're just experts at compartmentalizing, because I have to take care of the rest of my service, round on the next 10 patients, make the next series of decisions with a clear head, because those patients are counting on me to be at my best. But I'm still haunted in the quiet moments, walking up the stairs one floor to the next, or driving home at the end of that long day, standing at the bathroom sink, brushing my teeth. It doesn't disappear. It just doesn't get to run the show while I'm caring for everybody else. I had a mentor in training who had one rule that was non-negotiable. When something goes wrong, he said, you do not avoid that room. You do not run away. You lean in. You look the patient in the eye. You sit. You talk. And you stay. Because complications are inevitable, but abandonment is optional. And that really stuck with me much more than anything technical he taught me. He taught me a lot. But he showed me that really what defines a surgeon is not whether something goes wrong, because it absolutely will, but it's how you show up when it does for that patient and for their family. And this is the part of medicine that nobody talks about, because we carry every patient with us. But it reminds me to be grateful and to say so for the people in my life right now who matter the most. And since we're talking about families, I know some of you are dreading the political rants or uncomfortable questions or Aunt Flo's truly terrible fruitcake that might be coming up at an upcoming holiday dinner, but these are your people. These are your tribe. They're your family. And this week has reminded me that we do not get to keep anyone forever. So hug somebody this week, tell people you love them, and try to be grateful for your family, your loved ones, and this body carrying you through this short and beautiful life. Take good care.